When patients come in asking about hip replacement or having a diagnosis of hip arthritis when they're referred to our clinic for discussion with me, the hip surgeon, I really like to express with patients what a hip replacement is. And so what a hip replacement is, as you can see in this model right here, is what we're replacing is actually the head of our leg bone called the femur. And our hip is made up of the femur that goes into this part of our pelvis called the acetabulum, or the hip socket. And so when we do a hip replacement, what we're essentially doing is we are taking the bone of the femur that rubs on the bone of the pelvis, and because of arthritis, it's no longer smooth, the cartilage isn't working, you get friction the body doesn't like, and so it creates inflammation and pain. And so when a patient has failed all conservative measures, physical therapy, anti-inflammatories, and even injections in certain patients, and they can't function, hip replacement's a really, really good option. And so what we do for hip replacement is we dislocate the hip, we take the head and the neck off the femur, we cut that off. On the inside of the cup, or the acetabulum, we smooth it out, and then we implant a metal cup on the inside. We get good fixation with it, and then we place a plastic liner on the inside. Then on the femur side, because our bones are hollow, we actually will place a series of what we call broaches or implants into it until it gets either stuck or we fix it with cement because the bone may not be good quality. We then can place different size heads and different lengths to make sure our leg lengths are good, and then that's our hip replacement. And so what happens with the hip replacement is you have no friction in there because what's in there isn't yours, and so you don't have that friction related pain. So hip replacements, there's many different types. You can do different types of stems, different type of cups. The key thing is that your surgeon is guiding you to know exactly what's best for you in your situation. And there's also different approaches. You can approach the hip from the front, what we call an anterior approach, or in the past, the kind of workhorse or the standard that what we've always done in the past is what we call a posterior, where we kind of go in through the back of the hip, take out the capsule, dislocate it out the back, and do all the hip replacement from the back. In the past, the difference between doing it from the front and the back was fairly large, but we're now seeing that there's not a significant difference between the two. That being said, most people in the country, including us, are doing anterior hip replacements because it seems to be a little bit more soft tissue preserving, a little more comfortable for the patients. The initial recovery is a little bit easier. The important thing to understand with the hip replacement is if it's the right thing for you. And the best way to understand that, obviously, is to work with your regular physician, work with your orthopedic surgeon and talking about methods you've tried, and more importantly, if your hip pain that you're having now that's associated with your hip, or if it could be coming from other sources like your back, or even just soft tissues, meaning it's not your hip joint, it's actually some of the muscles that can get better with some exercise or even some physical therapy. Proper diagnosis would be one, to know if it's the right thing for you, and the second thing would be if you do have the right diagnosis and it is hip arthritis, making sure that it's actually the right time. And the way that you know it's the right time is when your hip joint is just not letting you function. It wakes you up at night, stops you from doing things you want to do, and you have to take medication to get through the day because of the pain. When that's the case, usually your hip joint, if that's the diagnosis, it's the arthritis, is bad enough that a hip replacement will be the right thing to do.